Chuck, one of your colleagues told the Register Citizen that this is not going to be a 1 or 2 week stretch. But let me start with where you are now. Where are you? What are your immediate needs?
Yeah, we're very stable now. I mean, it's amazing what a committed group of people can do in about 7 days. And we've dealt with a lot of the same infrastructure problems that you'll probably hear from my colleague there, Greg. Water, early on within the first 24, 48 hours, we were dealing with every infrastructure problem that you can imagine, from communications all the way to water and sewer and power. We are back on top of that. I feel like in 7 days, with the help of UNC Health and the state and all the federal resources that we receive, we're fairly stable right now. Our biggest concern at this moment is to make sure that we get those secondary supplies and things needed out into the community to prevent further folks coming to us in need of help.
So tell me what you're seeing in terms of the kind of incoming because of the storm.
It's everything from chainsaw injuries to obviously infections. The folks that weren't able to take their meds or to get oxygen, we're starting to see a lot of that. Unfortunately, we had established a lot to take care of those immediate needs, and a lot of those did not come, unfortunately, just because of the deaths that you're seeing reported in the news.
I'm wondering how your employees are holding up. There have to be some of them who suffered their own losses, right? Physical losses in terms of their homes being damaged, perhaps losses in terms of people who may live elsewhere in the state. They don't know what has happened to them. How are they doing?
They're walking around with red eyes but we've got some fantastic stories that have come out of this. People have driven their UTV for an hour and a half to get to our hospital because they wanted to come in and help others. We've had at least 10 families that we know of that have lost homes. We've tried to contact by phone every employee that we have. We still aren't able to reach about 42 employees. We hope that's an infrastructure problem and not a problem on their end. But our employees are so resilient. They're used to taking care of folks, and now we've just kind of taken down the walls of the hospital and extended that out into the community, and just couldn't be more proud of them in this moment.
And Greg, I think we were able to get you back. I was talking about the reports that Mission Health literally dug a well to get running water. There was no way to clean patients who had showed up drenched in floodwater, saturated with gasoline. I wonder just how challenging this storm has been for y'all.
Yeah, our teams are incredibly resourceful, and I really want to thank all of our caregivers and our teams that have done just an amazing job caring for all of our patients and anyone that's seeking care at our facilities. All of our hospitals, Mission Hospital and all of our regional hospitals, are open and serving their communities. As I mentioned, they've been incredibly resourceful. The first 24 hours were difficult, but we are structured, we're organized, and we're providing what's needed to the community.
Did a well literally get dug?
Yeah, the biggest concern for us right now is city water. So we have power, but city water is concerning. And so our crews and our engineers have been incredibly resourceful and brought in tanker trucks to be able to recharge the hospital and function at 100%. So we have showers, sinks, toilets, everything necessary to care for our patients. So I think that's important that I let you know what's really going on at the hospital. In addition, we're serving our employees and helping them be available to care for all of our patients by setting up mini marts with food and water and supplies for all of them. We're pumping gas through gas trucks for them to get to and from work. We have a Hope Fund, which is an employee-run and led charity that has processed dozens of applications for financial assistance, and those funds are already in their bank accounts.
That is extraordinary. I wonder how you're doing in terms of capacity, because I heard one report, for example, of a hospital that had an ER capacity of 100 and was serving 200 patients, including some who were waiting for rooms elsewhere in the hospital. Obviously, there are a lot of injuries, as we were just talking to Chuck about, that are related to the storm. How are you guys doing in terms of just being able to keep up with the patient load?
The demand for care is high right now, and we've partnered with DMAT to help in setting up a field tent to help with the surge in volume in our ERs. But our teams are incredibly resilient, they're courageous, and they've done an outstanding job in caring for every patient that comes in to receive care in our facilities.